Child Neglect, Causes and Prevention by Skylar Wheeler. Our class text, Understanding Child Abuse and Neglect, states that there are many reasons why neglect is not as demanded of as a research topic, and the majority of attention is given to its counterpart, abuse and maltreatment. Some of these reasons include that neglect is less dramatic than the physical markings and bruises of abuse, the effects of neglect are harder to see, and the intervention of neglect is not a cessation of an activity, rather than a gradual process of teaching parents the skills they need to meet children's needs. Let's dive into the causes of neglect and what can be done to prevent it. It is not news that child neglect and maltreatment has a heavy cost on society and causes lifelong health problems such as psychological problems, developmental delays, depression, low self-esteem, aggressive behavior, poor academic performance, difficulties in peer relationships, and criminal tendencies. The book notes that child neglect is hard to define. It is an omission of an action related to the developmental level of a child. Most experts divide neglect into three categories: physical neglect, educational neglect, and emotional neglect. Physical neglect includes non-organic failure to thrive, inadequate supervision, abandonment, and failure to meet a child's basic physical needs, such as feeding properly, sending a child to school in the winter or summer without appropriate clothing, a lack of proper hygiene, accommodation, safety, and medical care. Educational neglect includes allowing the student to be truant, failure to send a child to school or enroll them in school, and an inattention to the child's special educational needs. Finally, emotional neglect includes inattention to the child's emotional needs and when the caretaker refuses to tend to the child's serious emotional or behavioral disorder. Emotional neglect is a lack of attention or love. Most forms of physical abuse involve emotional abuse or neglect as well. In a study of child abuse and neglect from the perspective of a child, and shown in the table below, it was found that children find being abused or neglected by parents to be the top worst life experience over family breakups or being charged with a crime. According to An Overview of Child Neglect and Abuse, Types, Causes, Impact, and Prevention, the cause of neglect can be categorized into three factors: socio-economical factors, characteristics of the perpetrator, and characteristics of the neglected child. Socioeconomic. Some suggest that neglect is the response of stress and financial hardship can be the ultimate stress for families. Families that are experiencing financial difficulties can project their troubles onto children or completely separate themselves from the children entirely. Children are left to fend for themselves emotionally and physically while parents struggle to find ways to keep the rent and electric bills paid. An example of child neglect from someone who is experiencing financial hardship might be a child who constantly comes to school unbathed, smelling of body odor, and in unwashed or too small of clothes that might be inappropriate for the weather, due to the family not providing proper attire because of financial reasons and not seeking out resources for help. Characteristics of the perpetrator. Characteristics such as parents with alcohol or drug use history, young age, low level of education, a history of abuse or neglect, underdeveloped sense of responsibility, immature personality, or even a personality disorder can cause a parent to commit child neglect. An example of child neglect due to the characteristics of a perpetrator might be a young child that is brought to the emergency room with a large gash in the skin from a knife because the mother has an underdeveloped sense of responsibility and often leaves the child alone for long periods of time to hang out with friends or a boyfriend, leaving the child to fend for himself and ultimately injuring himself in a major way. Characteristics of the neglected child. Children with disabilities, mental or physical, as well as children with chronic disorders, are frequently the children found to be neglected due to the sheer amount of time and resources that needs to be put into caring for the child and his or her needs. An example of child neglect due to the characteristics of a child may be a child that comes to a kindergarten screening with a hearing impairment or hearing loss, leaving the child with extremely delayed speech because the parent failed to bring the child to corrective service appointments because it took up too much time. There are a few ways to go about preventing the act of child neglect, and most of it revolves around education. Education for the community. Teachers, police officers, caregivers, social workers, and other professions that are in contact with children should be taught and informed through regular meetings, seminars, and classes the signs of neglect and how to respond to it. Education of parents. It would be in the best interest of communities to provide training and counseling on stress management, as well as trainings that focus on helping parents recognize their abilities and incompetency to identified parents at risk. As stated before, financial hardships can often lead to child neglect, so teaching parents financial planning strategies can help alleviate stress, which can lead to better parenting skills. It is worth noting that in the study on child abuse and neglect from the child's perspective, it was seen that there was a strong correlation between what children believe they are going to become and what they think their parents expect them to become. Of the children who believed that they would turn out to be criminals, 72% believed that their parents thought the same of them. An increase in parenting skills could improve child morale and confidence, making children strive to achieve more out of life. Help for children. Children who are victims of neglect can experience extreme losses in life, the most irreplaceable being the loss of childhood. Offering comprehensive post-traumatic stress programs with children and families affected would benefit the child and work to stop the chain of neglect. Sustainability of all of these programs can be achieved by making necessary adjustments and keeping in mind the varying needs and levels of all parents. While it is unfortunate, child neglect is happening more often than some realize. Through education of those working in the community and of parents who are at risk of neglecting children, we will be one step closer to making the lives of all children better.